It bans funding to any foreign NGO carrying out or offering advice on abortions anywhere. The goal is to please Christian conservatives who strongly oppose abortion and are a major part of Trump's political base. MSI and the International Planned Parenthood Federation are among only 4 to reject the conditions of the order. They offer abortion services, in accordance with local rules, and say it is a last resort in preventing unwanted or unsafe births. USAID says 733 other NGOs still receive funding. But in Africa, MSI and IPPF are the 2 largest NGO providers of free contraception and family planning advice. The NGOs say the contraceptive programs are crucial in Burkina, where the fertility rate is 5.5 births per woman. In some villages, the MS ladies operate from government centers, supplementing the limited services on offer. The same grant also pays for training for health workers in 80 government clinics. MSI says the cuts mean programs affecting thousands of people in Burkina Faso are under threat. The U.S. policy says foreign NGOs must certify that they will not perform or actively promote abortion as a method of family planning in foreign countries, or provide financial support to any other foreign NGO that conducts such activities, as a precondition for getting global family planning aid from the U.S. government. This is the case even if the abortion care or advice itself is being funded by other donors. The rule was first introduced by Republican President Ronald Reagan in 1984. Republican presidents since have signed it, while Democrat presidents disagreed with the policy and reversed it. This means funding for such NGOs has been volatile. The policy has been in force for 17 of the last 35 years. A spokesman for USAID and an official for the State Department declined to say how much money the United States now provides for global family planning programs. In 2015, when Democrat Barack Obama was president, it was $638 million. MSI received around $30 million a year, around 9% of its total funding, before the cut. Seeking other donors, MSI say the cuts forced it to axe a voucher program in Madagascar and 22 out of 62 outreach teams there. In Uganda, 17 out of 35 teams are gone. And in Zimbabwe, where MSI has an extensive presence, it has shut down half of the 1,200 teams it had going from village to village. IPPF has shut 22 programs in sub-Saharan Africa and has others closing this month in Togo, Ethiopia, and Ivory Coast. This is because it has lost USAID funding, Caroline Kwambaka, IPPF Senior Advocacy Manager for Africa said. IPPF operations are not under threat in Burkina Faso as other donors finance its projects there. But as in other West African countries, government campaigns to persuade them to space births out for the sake of maternal health have been effective in recent years. In 2011, West African governments signed up to the Ouagadougou Partnership to try to reach an extra 2 million contraceptive users by 2020. Scrambling for funds with their funding under threat, NGOs and others are looking for ways to keep their coffers full. In February, Trump singled out the UNFPA, the single largest provider of free contraception in Africa, for a funding ban, on grounds of complicity in forced abortions in China. The UN agency denies this. In 2015, the agency received $32 million in U.S. funding. But other country donors were so alarmed by Trump's cut that they covered the shortfall and increased the budget in 2017, said UNFPA's West and Central Africa Director Mabingwi Ngum. There was a positive impact from the U.S. cuts to our funding, he said. It ended up bringing us more resources. An official for the U.S. State Department, which is responsible for USAID, said if an NGO loses its funding, it tries to help shift operations to other NGOs. When an NGO has declined to agree to the policy, affected departments and agencies work to transition the activities to other partners, the official said. MSI and IPPF are taking steps to shift away from U.S. funds. We made a conscious decision to ensure that more recipient countries had more funders. This meant designing our proposals to include more country profiles that matched our donors' priorities, MSI spokesman Will Harris said. The fluctuating funding has also been a wake-up call for African leaders who promised in 2015 to boost healthcare to 15% of government spending. Most are behind target. Commitments have been made, but the money has not been forthcoming, IPPF's Kwambaka said. This reliance on aid from other cannot go on.